Hello, hello, hello. Good morning, good afternoon, good evening, or good night, whatever time you're listening to this. This is Rihanna hosting for Black Mental Health Matters. And today we are going to be discussing pediatric mental health with Ciara Pearson. Now, before I bring Ciara on, I'll give a brief introduction to what she does and who she is. So, Ciara has earned a dual Bachelor of Arts degree in Psychology and Criminal Justice from Rider University and is currently pursuing a Master of Science degree in Clinical and Mental Health Counseling from St. Bonaventure University. With 4 years of experience in mental health and behavioral health space under her belt, Ciara is passionate about destigmatizing mental health in communities of color. Through her wellness business, Fresh Start by CNP, Ciara offers coaching, professional organizing, and psychoeducation services in the hopes of bringing healing to her clients. Now, I'll bring Ciara forward so she can introduce herself. Hello, welcome, Ciara. Welcome, welcome.
Hello, thank you for having me.
Thank you. Thank you. So, welcome to Black Mental Health Matters, and thank you for being a guest with us today. I know that we have spoken a lot about this topic over, say, yesterday and a couple of weeks. So, it will be great to have this discussion with you and delve into the topic of pediatric mental health. So, would you like to just give the audience a bit of an overview of who you are, what you do, and we'll get into the discussion?
Yeah, so again, my name is Sierra Parson. As was mentioned, I'm currently pursuing my master's degree in clinical mental health counseling, and I currently work as a crisis clinician for a suicide lifeline. And I'm also starting a new role as a mental health associate at a hospital.
Lovely, lovely, lovely. And whilst we was preparing for this subject, me and Ciara was talking about what kind of things we would like to discuss. And from my knowledge, Ciara has extensive experience working within autism services. Now, we will be discussing that, but we also will just be discussing generic pediatric mental health as well, which we find um, needs the highlight, needs the resources, needs the attention and awareness and support. And particularly as we've come out of the pandemic, we are very aware of all the different types of support children are needing in order to kind of cope with the residuals of the pandemic, but also just the pressure of life in general, and this can present itself in many different ways, whether it is changes of behavior, sleep issues, eating issues, being withdrawn and isolated. And we're just going to be touching upon some of the issues that people might face, as well as how parents can be supported in seeking help. And we'll touch upon some of the awareness campaigns that have been happening, not only in the UK, but in the US as well. Okay, so Ciara, I know we was discussing a bit about why it's important for this discussion to happen, and something that we kind of agreed upon was not only for the purposes of parents seeking advice, but also being afraid to reach out. So I just wanted to throw it over to you and get your thoughts on to why this topic is so important for us to be discussing at this time of the year, or just in general.
Right. So, in general, there can be a lot of stigma, with mental health in general. Um, and then what I've seen with a lot of parents who may be afraid of their child being discriminated against on the basis of a mental health diagnosis. And so sometimes that may stop parents from seeking help because they don't want their child to experience that type of discrimination or those types of stigmas. So having these conversations helps bring more awareness and more understanding of it. So then that kind of helps reduce that fear of
Mm.
reaching out and getting that help.
Yeah, yeah. And I think it's so important because a lot of the time, when there are suspicions that your child might be facing some sort of mental health distress or emotional trauma, it can be quite difficult. And sometimes people just, bury their head in their sand and hope that it goes away. And that's not always the case. You know, a lot of the time people say they'll grow out of it, or, you know, pray on it, something like that, when sometimes intervention is required. And I believe it's very much important for us to be having these conversations, particularly around the support around diagnosis as well as prevention. And I know that we spoke a bit about Children's Mental Health Awareness Week that was happening over here. That's gone back in February,
Mhm.
7th to the 13th of February, and the theme for it was growing together. And the focus of that was mainly around, again, breaking the stigma, opening up those conversations amongst parents and professionals, as well as with children as well, and just holding those safe spaces for them to be able to have those safe and open conversations, learning from each other, building that resilience, and again growing together through these issues that that children are facing. So I know you mentioned in the US it's coming up with April, which is Autism Awareness Month. Do you want to tell us a bit about what's previously happened in the US and what we might be looking at in the coming month?
Yeah, so for April, it's Autism Awareness Month, and it's something that is celebrated by the organization Autism Speaks.
Hmm.
So it's kind of an opportunity to have increased awareness and increased conversations surrounding mental health and surrounding more specifically autism, and to kind of garner support for individuals who have autism.
Mm,
And so a lot of times they'll do walks or different events, and you can go, you can walk, you can run, you can volunteer. I've volunteered at an event before.
hmm.
There's different things that you can do as a volunteer. You can be passing out T-shirts and
Mm,
different things of that nature. And so throughout the month, you'll often see people wearing the color blue.
mm,
That's been sort of the symbol of autism awareness, is the color blue. And
mm,
then more specifically, April 2nd in particular is World Autism Awareness Day. So
mm,
that's, not just within the US, but throughout the world. April 2nd is like that day to kind of have more of a focus on autism awareness.
mm. Nice, nice. Thank you for that. Thank you for that. And I think what would be helpful, particularly for viewers that aren't very much aware of what autism is, would you be comfortable giving a definition or just a bit of an overview of what autism is for those that might not understand or know what the condition is that we're speaking about?
Right. So without stepping out of my realm of competency,
Hmm.
um, autism, there can be different levels to it,
Hmm.
depending on the individual, and it can manifest with, I guess, different presentations of it. So, some people with autism may experience social impairments. So, they may have difficulties making friends or interacting on a social level, or kind of picking up on, sort of those social cues. So, for example, something you might see is, a lack of eye contact
Hmm.
with children in particular. And, again, it depends on the child because every child is different. Um, but sometimes some of the things I've seen is some children, um, let's say if they go to hug a parent or hug someone, they won't go in the
Mm,
the way we would usually go in for a hug. They'll kind of walk backwards and back into the person, and that's
mm,
like their form of a hug. So that's just an example of a way that could present.
mm,
And then, so along with the social impairments, there could also be impairments in terms of communication
mm,
and everyday functioning.
mm, mm. Okay, thank you. Thank you very
You're
much.
welcome.
So I think it's really important for us to know this as well, because especially in a society that speaks well, in a world that with many societies, we speak a lot about identity and self-identifying as well. And being able to identify the different presentations that someone might present themselves, whether it is a child or an adult, without stigmatizing, without jumping to conclusions, without making an assumption, it's very important to be aware that these are some of the types of behaviors that are associated to different conditions. So, I would like to ask you, tell us a bit about why you got into this field of study and your work as well.
So when I first graduated from college, I was had a period of time where I was a little lost. I wasn't really sure which direction I should go in, what I wanted to do. And
Hmm.
so I knew I wanted to work in psychology. So I was just applying for any job that had anything to do with psychology.
Yeah.
And so I ended up stumbling upon um, ABA therapy. I applied for the job, I interviewed, I was offered the job. And from there, I fell in love with it.
Mm.
And so that's, that was like the beginning of me getting into working with, specifically working with children
Hmm.
who have autism.
Mm. Mm. Okay, lovely, lovely. And I know that you mentioned just now ABA therapy. Would you be able to tell us a bit more about what ABA therapy is, and the application? Explain the application of the therapy for our listeners.
Sure. So ABA, it stands for Applied Behavior Analysis, and it's most often associated with autism. So, usually, for those who are familiar with the term ABA and know what it is, people hear ABA and right away they think of autism. There's, that linkage there. It's, I would say, a very scientifically proven method for treating autism.
Hmm.
Um, and so it kind of looks at the functions of a behavior. So, really, why a certain behavior may be occurring. So, say, for example, if a child, one of their behaviors is they hit people,
Hmm.
it's looking at why they're doing that. Is it for attention? Are they trying to escape from doing something that they don't want to do?
Right.
You know, so that knowing the function of behavior can help you remove that problematic behavior. So with the hitting, maybe they're hitting because that's the only way they know how to communicate. There's something they want to say and they don't know how to say it verbally,
Mm.
but they know
Mm.
if they hit someone, it's going to get a response. And so there's different examples of, with that.
Mm. Interesting, interesting. Thank you for that. And I know we were speaking a bit yesterday about the different types of conditions that ABA therapy might also be applied to. And I know you said it's usually associated to autism, but are there any other behavioral presentations that this could potentially be applied to?
Right. Well, so again, it's applied behavior analysis. So it can be applied to any behavior, not just specifically within the world of autism, but if you're looking at behavior, what is behavior? A fun way to remember it that they tend to use it as an example is it's called the dead man test. And so they say if a dead man can do it, it's not behavior.
Okay.
So anything that a dead man can't do would be behavior. And so, outside of the world of autism, I had a friend who, for her thesis research, she used ABA to train dogs.
Mm.
That's, one example of how it can be used. You could use ABA as a consultant working with different companies. Anything having to do with behavior, you can use ABA.
Mm. Mm. Okay, so that's interesting because I know that particularly where a lot of organizations are going through like culture shifts, and they're looking at organizational development, it'll be interesting to see if there is any ABA type work included in that type of organizational psychology as well. I know that's a little bit out there, but yeah, it was just a thought that I had. But okay, interesting. So in regards to ABA therapy and any recent case studies and showcasing how it's applied, um, what has been the outcome for yourself that you've seen when this ABA therapy has been applied with children with autism? What has been the differences and outcomes that you've seen that you can share with us today?
Well, one thing that has been found is that early diagnosis is key.
Mm,
So for parents, if you do have some concerns, you're not sure what's going on with your child, maybe they're having some behaviors that you don't really know about, you're not sure what it's about. Um, the earlier you receive a diagnosis, the earlier you can start services, and then the better it will be for the individual in the long run.
mm, mm. Okay. And I know that when it comes to autism, whether, you know, they're going down the route of exploring diagnosis and assessment, particularly when it comes to adults, there is a lot of issues and barriers that might be presented when trying to access an assessment or even getting autism support. Um, but I know that of recent, it's been a bit easier for children because there's more awareness around it. And I believe because of the awareness raising that we do,
Mhm.
shows like this, it does help lower the stigma of actually accessing support and help. But from your perception, what is the stigma around autism? Um, and how can we overcome that as a community?
I think not only with autism, but just, again, that stigma around mental health in general. Um, and especially with, receiving or seeking a diagnosis, depending on the person or depending on the family receiving that diagnosis, it can be helpful because it
Mm,
can, help put things into perspective and kind of, okay, this is kind of what it is. So now I know what area to look in and what direction to go in to find help. And
mm,
then for other people, it can, it can be more scary, and knowing the diagnosis isn't necessarily always helpful, just in general, across mental health.
mm, mm.
Excuse me.
All right. No, it's very true. It's very true. And I think, particularly when you're talking about general diagnosis, some of the issues that having a diagnosis lead to is the labeling and potentially having the label used against you rather than in your favor. So I could definitely understand what you're referring to there because it can either help or hinder. Um, but again, it's also down to how it can be helpful to the person to understand themselves, understand the support that they need, and like you said, particularly for children as well, what kind of support their families can access on their behalf. Could even be like financial support as well as
Hmm.
educational support and behavioral support. So it's very, very true.
And
And
then
go ahead.
with that, you mentioned with the labeling, even with that. So let's say a child receives a diagnosis of autism.
Hmm.
And so now they're being labeled. And then, you know, oftentimes all of a sudden people want to associate everything the child does and pin it on the autism.
Yeah.
Not every behavior is autism related. Some behaviors are just behaviors that any child would have as a, a young child,
Mm,
so it's important to kind of keep that in mind, and knowing what behaviors are kind of a side effect of the autism and what behaviors are just normal child behaviors.
yeah. Yeah. And with ABA therapy, how would that be able to be distinguishable? Because professionals get things wrong sometimes as well,
Right.
but how would that be distinguishable during the process of applying ABA, well, applied behavioral therapy?
Well, typically a BCBA, which is a board certified behavior analyst, which is kind of like the clinical supervisor of a case. They would, you know, speak with the family, do observations with the child, look at the child's age and look at what behaviors are developmentally
Mm,
appropriate, and through those observations and speaking with the family, kind of seeing what behavioral concerns the family might have for their
mm,
child, and parsing out, okay, what's developmentally appropriate, and then what is actually resultant from the autism.
mm. Okay, interesting. And then I guess from that whole team approach or holistic approach, they'll be able to make inferences around what could potentially be causing and make suggestions for prevention and reducing the signs and behaviors as well, I guess. So,
Right. And so once the BCBA, does the observations and goes through that whole beginning process of starting therapy, then they would put together, a treatment plan, and figuring out, what are the target behaviors that we're going to focus on first, and how we're going to go forward. You don't want to focus on everything at once.
mm,
So you kind of, which behavior is the most severe, the most pertinent for the family, and
mm.
then starting with that, and then the BCBA would, create and implement that treatment plan.
Okay, okay. So it's really important to have that time with the family, with the child, um, and obviously with your clinical team to be able to give a full um, analysis, I guess, of the child. And
Right.
what we said before is that yeah, sometimes professionals can get things wrong, but without that allocated time, that dedicated time, and the different information that goes into what makes up this one child, it's very important for accurate diagnosis as well as an accurate treatment plan. So again, having these types of awareness raising events enables us to be more informed of what to look out for in order to know when to seek help as well.
Right.
Lovely, lovely. So my next question to you, Ciara, is oh, where's my questions gone? Bear with me. So in your professional work, has there been any specific differences around diagnosis of autism and or ADHD that you can tell us about? When I say differences, I mean demographic differences that we can talk about.
All right. Well, I think from what I've seen, you mentioned ADHD. So, in relation to ADHD, I've seen that boys are most often received a diagnosis in childhood as compared to girls.
Hmm.
Usually people hear ADHD and they think of the hyperactive,
Mm,
but there's also the inattentive side, which
mm,
is how ADHD more typically presents in girls. And so, because of that, girls tend to not as often receive that diagnosis in childhood.
mm.
So, using myself as an example, last summer I was diagnosed with ADHD,
Okay.
inattentive type.
Hmm. Hmm.
And so now having that diagnosis, for me, it put things in perspective. Things from when I was younger, it's like, oh, well, that makes sense now. It would have been nice to have that information years ago, but it's
Yeah.
nice to know that now.
Yeah. Yeah. Okay. Thank you for sharing that personal story. Because I know it can be quite difficult to, self-disclose a diagnosis, let alone how it may have impacted you. But from your perspective, if you're comfortable to share, how did that impact you when you decided to seek the support and once you received the diagnosis and the actual process?
So, being that I am in grad school for clinical mental health counseling, and we're kind of, learning about all these different diagnoses. And so I'm reading about ADHD and kind of the diagnostic criteria for that. And there's a lot of things that I'm relating to
Mm,
within that diagnostic criteria. And so I reached out to my psychiatrist and I said, hey, I think I might have ADHD. Can we do an evaluation
mm,
to see? And she kind of brushed me off. A few weeks
mm,
passed, I brought it up again, brushed me off again. So I ended up reaching out to an ADHD specialist, and
mm.
then who ended up going through the assessment process with me. And then that's how I ended up receiving the diagnosis.
Oh, wow. Wow. Um, that's interesting that you say you got brushed off. Why, what,
Yeah.
why do you think that was?
So I also have anxiety and I also deal with depression. And so some of the symptoms that I was describing to the psychiatrist, she was saying, oh, that's just the anxiety, that's just the depression. And, you know, I always say, you know yourself better than anyone else. And
Yeah.
so for myself, I'm like, I don't, it's more than that. It feels like it's more than that.
Yeah.
And so after the second time bringing it up to her and she kind of dismissed it as just being the anxiety, just being the depression, I
Mm,
was like, no, that still doesn't feel right. And so I ended up seeking out a specialist.
mm. Interesting. And it's I'm so glad that you did because it's, I find when it comes to neurodivergent conditions, they are very much they can be misdiagnosed as mental health conditions whilst we know that there is some comorbidity between them,
Right.
and some mental health conditions do fall under the neurodivergent spectrum. I think it's very important to pay attention to patients when they do say that they think this or they think that, even if it is a method of elimination for the patient's own peace of mind. But
Right.
I'm glad you was very proactive and you sought a second opinion, um, and that you was able to go through that assessment period with someone that is specialized within the field of study, of where what you was trying to achieve. So well done, very brave of you to
Thank
share as
you.
well. Thank you.
And, thank you. And I think a big part of that is the fact that I have that background and I have that
Mm,
education to where I could say, okay, I think this is what it might be. Can we look further into it? But there are so many people, so many families that don't have that knowledge and they
mm,
don't know what questions to ask or what to look out for. And so it's, you know, like you were saying before, having these types of conversations to build that awareness and build that knowledge so then people know where to go and what to ask and how to advocate for themselves.
yes, yes, absolutely. I'm all about advocacy. My background is advocacy within health and social care, mental health services. So I'm a big believer in people being able to have the information, being able to discern what actions they need to take for themselves and making informed decisions. So, yeah, a big part of what I do is ensuring people have the tools and resources so that way they can make decisions that most impact their lives. So yeah, in a big agreement there. So tell me a bit about the activism and advocacy within reducing stigma that, um, within our Black and Brown communities would be helpful with, particularly around autism, but just generally around destigmatizing mental health.
I would say having more of these types of conversations, more of an availability of resources,
Mm,
surrounding mental health and having those resources be easy to access.
mm,
There's a lot of information out there, and so it can be helpful to kind of have that information be condensed
mm.
and for people to know where it is.
Yes.
And, this is okay, here's this resource. And I know if I go on this resource, I can, you know, search through it and maybe not find all the answers I'm looking for, but it's a starting point
Mm-hmm.
of where to go next.
Mm.
And I think, you know, having more compilations of that type of knowledge and resources and information and making it easily accessible.
Yeah. Yeah. And I would add to that, making it culturally appropriate as well, because I find when it comes to services, people that look like us aren't usually on the leaflets, not usually mentioned, and it would a lot of the time feel as though that service isn't for us. Um,
Mm,
and I think it's very important to be culturally aware as well as culturally appropriate with it when we're designing services and practices, and applying certain treatments and interventions. But just taking into context that person's cultural needs as well. That's also very, very important because it depends on how they would receive the treatment, the therapy, and even the diagnosis as well.
right.
So yeah, thank you very much. Um, so I think the next thing I remember we were speaking about your own company. You've got your own organization, I believe, called Fresh Start CNP. Um,
Yes.
yes, tell us a bit about that. What do you do there? How did it start?
So I started Fresh Start back in September
Hmm.
of 2021. And I really just wanted a way to help get that education out there and help reduce that stigma surrounding mental health and surrounding seeking therapy and seeking treatment specifically within communities of color.
Hmm.
And so I've kind of been uh, learning as I go in terms of, I guess, the process of reaching the most people and
Hmm.
how to get that information out there and what the best way is to do that. And so I'm, you know, still learning as I go.
Yeah. Well, we're all lifelong learners, absolutely. And I think what you're doing is amazing because no matter what, we need the information out there, like you said, making it more accessible, making it culturally appropriate, making it available in abundance, and in places where everyone is able to access it is important. So I'm looking forward to seeing more of what Fresh Start provides as well. So I know I mentioned it earlier, but you provide coaching, is it? So what type of support and services do you provide under CNP, Fresh Start CNP?
Uh, well, one thing that I love doing is organizing and helping people
Yeah.
uh, with organizing, whether it's organizing an office, organizing a closet, organizing your kitchen.
Mm,
So that's something that I offer. Um, I found
love
that
that.
having a clean and organized space kind of frees up space in your mind.
Absolutely.
So that's one thing that I love doing, and so I love helping people with that in that aspect.
Lovely.
And then on the for the coaching side of things, I think just helping people who have be like I was at one point, feeling stuck and
Mm,
kind of not knowing what direction to go in, and helping them figure out what it is they want,
mm,
whether, you know, out of life in general or out of a career, and helping them find ways to get to that place of where they want to be.
mm. Lovely, lovely. And yes, we're definitely needing that service, particularly again as we're still in these residuals of the pandemic. People are making this big shift. I don't know if you've heard of this, the Great Resignation. You know, people are moving
I
on from their
haven't.
pastures. Yeah, it was something that I saw on LinkedIn. Just around a lot of people feeling like, do you know what? I want a career shift. I want to resign from where I am at and try something new. So where there is people feeling like they are a bit stuck, I'm sure that anyone that is feeling that burden will reach out to you for some support and guidance on how they can make that next step. That next step.
Yeah, I think a lot of people are also having kind of these realizations about themselves and
Mm,
through TikTok. I know throughout the pandemic, I've learned so many things that I never knew about on TikTok, and so it's really interesting to just see all this plethora of information just coming out of nowhere that so many people are like, "What? I never knew that."
yeah, yeah, it's true. It's very true. Social media has definitely enabled a different realm of knowledge, I guess. And again, being able to do shows like this and on a few social media platforms enables us to prevent other people that might be feeling worried or scared around seeking diagnosis for autism or for their children. This is a way to provide information and provide encouragement should they need to seek the additional support. So yeah, I agree. Social media could be used for good. Um, it can be used for good, despite what people may think.
It has its
But
pros and its cons.
absolutely, absolutely. Okay, Ciara, thank you. So I think as we're rounding off, I'm gonna ask you just an impromptu question that we didn't prepare. But
Okay.
what would you say is your top three tips that you can leave one our viewers with that would enable them to better access or find resources on how they can seek more information and advice around autism and potentially other neurological conditions? Your top three tips.
Let's see. I would say one, start with an internet search. You know,
Hmm.
if you kind of you don't know what you're looking for, you don't know where to go, you can, starting with that internet search can kind of help you get an idea of where to go next, maybe give you specific providers that you could reach out to.
Mm,
I would also say if you have a primary care provider, reach out to them.
yeah.
Speak with them about whatever concerns you may be having, and they can help provide you with additional resources, and pointing you in the direction of where to go next, maybe with a referral to a specialist or whatever it may be
Yes.
that they end up recommending. And my third tip, I would say, keep in mind that you know yourself better than anyone else knows you. If you feel deep down something is off, you think it's something different than what a doctor or anyone else may be telling you, but you still feel like, no, something's off, something's not right, listen to
Mhm.
that inner voice.
Absolutely. Absolutely. That's amazing. Three great, amazing tips. Thank you so much. Um, and I think the final thing I would probably add is self-education. It's one of the biggest tools that we have. So alongside the Google searches, um, download information, go back to it. Don't rush into it either. Take your time because it can be quite heavy, and especially if you do identify with a lot of the resources and material, definitely take your time with it. Go back to it. Talk to your friends and family if you're able
Mhm.
to, or talk to a trusted person, because I think it's very important that you don't go through this journey alone. A lot of the time it can be very isolating, especially if you feel like you're the only one. And
Mhm.
also support groups as well, because if you do identify with any of the um, behaviors and you are unsure of what next to do, usually someone that's gone through the process would be the best person for advice if you want some emotional support around it. So seek some support groups as well.
Yeah, definitely do some digging and find your people. It may not. Unfortunately, our families aren't always so supportive when it comes to issues with mental health
Yeah.
for whatever the reason may be. And so, getting out there and finding your people that can be that support for you.
Yeah, I call it your vibe tribe.
I
Find
like
your
that.
vibe tribe. Okay, wonderful. So, Sierra, it has been amazing talking to you today. And you shared so much nuggets of knowledge, so much gems and examples as well, which I love. I find sometimes when we have these kind of discussions, the examples are a little bit difficult to pull out the bag, but you nailed it, definitely. So, thank you so much.
Thank you
Um,
for having me.
and just before you go, can you let people know where they can find you if they want to reach out to you, whether it's for resources, information, or just some coaching for your Fresh Start CNP?
Yes, so I am on Instagram at Fresh Start by CNP. And you can also email me freshstartcnp@gmail.com.
Lovely, lovely, lovely. Thank you so much. So that is our show for today, everyone. We've been joined by Sierra Parson talking about pediatric mental health, um, general mental health, as well as some specifics on autism and ABA therapy. I just want to thank everyone that has joined us today on our Facebook channel, YouTube, Twitter, LinkedIn, wherever you're watching this. Thank you so much. I'm your host, Rhyana Ebanks-Babb. Black Mental Health Matters, wishing you a wonderful Saturday. Have a great day and take care. Bye bye.